with the artery, mostly with the artery.
How smoking affects the heart?
Smoking can affect the heart in several ways. Number one is by reducing the oxygen in the blood. Number two, on the long standing, you get something called atherosclerosis. That is what's called blocking of the heart.
Yeah, that narrows.
Okay.
How alcohol and drugs affects the heart?
Well, alcohol, if you drink a lot, the heart muscle can get damaged. Drugs, there are so many medications which can also affect the heart.
Yeah. What is the difference between sinus and ventricular tachycardia?
Well, sinus tachycardia is abnormal heartbeats originating from the sinus node or top part of the heart.
Meaning from
When
the SA node.
Need not be from SA node, it is from the top part of the heart, atrial part. And
It's only coming from there.
Atrium area.
Yeah.
Whereas the ventricular one is from the lower part of the heart, that is the ventricular area.
So sinus is from like that tachycardia is happening at the top part of the heart.
Top part where the sinus node is, yeah.
And ventricular is at the
At the bottom where the ventricle is, yeah.
Can children also have cardiovascular issues?
Yes, they can. They can. But in children, we usually see more congenital heart disease. Congenital heart disease means you are born with defects. It could be a hole in the heart, hole in the valve, a tight valve or a leaking valve, all kinds of things. You can be born with that. Or connections, wrong connections, the artery is connected to the wrong side, veins connected to the wrong side.
What is the number one cause of heart failure?
Heart failure, ischemic heart disease, that is blocking of the arteries, that is the commonest cause.
When there is extreme bradycardia, what do you do?
It depends. Bradycardia means slowing of the heart. If it is normal, what is called a sinus bradycardia, we may not do much if the blood pressure is normal. But bradycardia could be due to various kinds of blocks. Then you have to give either medicine or sometimes you have to put a pacemaker.
Or we just pace the heart. But that could be painful a little.
That is what is called a pacemaker. Yeah.
What is an ICD?
ICD is a intracardiac device. It is a machine we put so that if the heart goes very fast, it shocks by itself. If it goes very slow, then it kicks in. So that is a device we put in the heart.
Okay.
What are the different layers of the heart?
That you should tell me.
Yeah.
Endocardium, myocardium, pericardium. Three
Endo-
layers.
Huh?
Endocardium, myocardium, pericardium. From inside out.
Is there any treatment for atrioventricular septal defect? If so, what is it?
Atrioventricular septal defect, if it is very small, it can be left for a while. Now, if it is small enough, you can do what is called a device closure. That means you just put a little press button like thing on the hole and close the hole. If it is large, you have to operate.
What do you do during the operation?
During the operation, you take pericardium and cover the defect with the pericardium.
What is bad, HDL or LDL?
That you should know. HDL is good cholesterol, LDL is bad cholesterol.
Is there any chance that kids can get these cholesterol problems?
Well, we see children previously, all the authorities or guidelines say that check cholesterol from the age of 20. Now we start doing it from 12 because we are seeing more children with high cholesterol.
From 12.
12.
Yes.
I'm hearing that. Where is the bundle of his located?
In the heart.
No, where in the heart?
Septum. The septum.
Okay.
The in between wall. Yeah.
What is the most common place where coronary artery blockage can happen?
Oh, it can be anywhere, but mostly in the left anterior descending artery. But it can happen any artery. There's nothing like common.
How are you able to find blood pressure through a sphygmomanometer?
That is a standard measurement. We just auscultate or listen, and we just see when the heart beats his head, and that is the top one. And when the heartbeat stops or sound stops, that is the bottom one.
Like when it stops, that the
When you
reading
listen,
that is the
when you listen at the blood pressure, top blood pressure, the heartbeat starts to hear, and it is called the Koshako sound.
Huh?
That's the sound. It is by a Japanese name. When you listen here, at the top blood pressure, you start hearing the sound like that. And the bottom, the sound disappears. That is how you measure.
Okay, finally, is there any is there any website in which I can learn more on heart?
Oh, there are hundreds of websites. You just Google anywhere, you can get.
Okay. Finally,
Or if you want more accurate ones, you
no,
can
like
go.
fun, which is fun, no?
Fun.
Fun to do.
If you want to have official information, you can go to American College of Cardiology, European Society of Cardiology, any of the cardiology sites for a real one. Otherwise, just go on the
Okay.
Google, you can have thousands.
Finally, is there like any chance where I
I
can
thought there's only one finally.
sorry, I didn't know that was coming. Finally, is there any like chance where I can go into a surgery unit and see like a pumping heart of someone?
There are chances. Usually we don't allow because children often faint and this and that, so we don't. And then you have to get permission from the patient. We can arrange that. It's very difficult.
We have to get permission from the patient or doctor.
No, patient also. Patient will not. If suppose we are doing an operation only, would you like to see the public to see that? Would
No,
you?
because like one girl, like I think she's a relative. Like she was welcome to go into the surgery unit and see a pumping
No.
heart of a
First
patient.
of all, we have to ask the patient. We have a non-medical person who want to watch your operation. We have to get that done. Otherwise, you can be sued for $1 million. Number 2, you have to have the permission from the operating surgeon. Number 3, you have to have permission from the sister in charge of the theatre. That's the procedure.
Assistant.
Sister or
Sister
nurse
in
in
charge.